Limpopo Health MEC Phophi Ramathuba says several issues of concern have arisen in the province as a result of the coronavirus quarantine process, and they are being addressed. Ramathuba says Limpopo Health is ready to step in and do whatever necessary when asked by President Cyril Ramaphosa. She was speaking on the sidelines of a Polokwane breakfast briefing with the health minister this morning.
Quarantining 122 South Africans trapped at the epicenter of the coronavirus is a matter of huge contention here in Limpopo. Many have said that Limpopo is now being used as a dumping site, but others really offering, their help to ensure that this is a smooth process and allow for the protection of other citizens here in this particular province. The host has opened its gates to the quarantining processes and says they want to make sure that all goes well without, of course, any infections. Many have lamented the devastating effects it could have if there could be more infections, particularly because this province does not have not even a single infection right now. I've got with me Health MEC Dr. Phophi Ramathuba. Thank you so much for your time, MEC. Last night, we heard the minister speak about the students from the TVET college that returned. It was really a matter that was of debate, particularly here in the Limpopo province. A lot of people not really trusting. Do you think that the minister's word now allays the fears that they've been tested and they're negative?
I think we must reiterate our position as the Limpopo government and the Department of Health specifically, to say we are concerned to make sure that any single suspect will be picked up as early as possible. And after the students returned from China, this is not the only group of students that have returned to China. All of them, as long as you are not coming from Hubei, Wahun City, you will not be treated like this particular one that is to be evacuated. But those students followed this normal procedure that all the other students did. But however, after the whole outcry, we discussed together with the minister and the premier, and the minister authorized that can the NICD allow us to do this test, even though they don't meet the WHO case definition of those that must be tested, because these tests are expensive. So we are saying, as we have indicated, to say these learners are not positive, these learners are not at risk. When we say self-quarantine yourself, we are just saying do it so that we can satisfy ourselves. And indeed we are relieved that the results are out. They were not done by us as a province. I was just there to supervise with our doctors. All we did was to collect the specimen, send it to the NHLS, and the laboratory did the test, and they are all negative.
And the Polokwane hospital is one of those hospitals that are on standby if any case were to break out here in the province. A lot of people have really raised their concerns, particularly the ANC Youth League in the province, raising their concerns about the possible infections that could happen as a result of that quarantine process that will be underway when those people land here in the province. Talk to us about, the state of readiness. Really, are you going to be able to contain the virus should anything happen, should anything fall through the cracks of the military?
I think we need to first indicate that the operation that is currently undergoing at the range, it is neither the decision of the province nor that of a Department of Health. It is a decision of the military, as led by the commander-in-chief himself, the president. And ours, what to do is that once the commander pronounce or anything, we must just run as foot soldiers and implement. What we need to indicate is that as a province, through our premier, we have raised a number of issues internally that were of concern when these news were broken to us. And indeed, those issues, I can reassure you, the ones that affect the health department, we've been able to iron them out. The ones that affect the workers also, Minister Nkosazana was with the workers yesterday because it was of our concern. But when it comes to us as a province, is to say any case that will be picked up within the province, which is our mandate, we will be able to deal with and to manage. But any case that will happen within the quarantined area, that is not going to be handled by the Limpopo government. It has got a team of all those experts that have been put together by the minister. As we speak now, we will be welcoming some of the doctors from Charlotte Maxeke, which we know is a central hospital. You are quite right. As a province, we don't have any central hospital. And I'm glad that the ANC Youth League raised this sharply, even in our meeting yesterday, to say we've been asking for a central or an academic hospital. And this is something that the national government must make sure that they look into and make sure they deliver it. And we were reassured that this time around, it's not going to be promises. We are going to get this central and academic hospital, because if we were having such a facility, I don't think these issues that many people are raising would, because we'll be having our own internal expertise. But currently, we are training the students at the University of Limpopo, utilizing both Pietersburg and Mankweng and some of our regional hospitals, which is not an ideal situation. We really agree with the Youth League in the sense that we need that academic hospital, because that decision has been taken, and we are glad that even yesterday it was re-emphasized and to be one of those that will be dealt with. But the people of Limpopo must understand, as the minister has indicated, all those people who are coming who have been evacuated, none of them has tested positive for corona. Otherwise, there was no need. Anyone who tests positive, I would say as a clinician, leave them in China, which we are sure of their health system, the way we know that they will be cured. But those who are negative, who are trapped, they are our children. Most of the leaders, even some of my colleagues, were saying, MEC, I'm also a mother. I have a child who's studying somewhere. If this happened to my child, I would appreciate if any government can welcome. So we're saying, all those issues having been ironed out, we will be welcoming them to go to the range, because it's the military health that will be in charge, not the Limpopo Department of Health. But of course, because the nature of the sector we are working in, if there's any emergency which warrant us to come on board, we can't say no, we are refusing. We'll definitely come on board.
All right, there you have it. MEC for Health here in Limpopo, Dr. Phophi Ramathuba, there explaining to us that they are ready and willing to step in should the Commander-in-Chief, which is the President, indicates or says that they should do so. Like I indicated earlier on, this of course is only a task that can be called by the President, and right now that evacuation mission is currently underway. For Newsroom Africa on Channel 405, I'm Lynn Damnisi in Limpopo.